Welcome to an ASRM webinar on Human Resource Management, Important Return to Work Considerations and Preparing for the Second Wave. I am Sarah Ramaya, Curriculum Designer at ASRM, with my colleague Jessica Goldstein. Joining us are panelists Sarah Mooney and Marianne Kreiner. Before we begin, please note, all attendees will be muted except the presenters. Time at the end of the presentation will be reserved for questions. Please type your questions in the question chat window at any time. We will read as many selected questions as possible to the presenters during the allotted question and answer time. A recording of this webinar will be archived on the ASRM website in the coming weeks. Please watch your email for notification. Let me introduce our panelists for today. Sarah Mooney is the Director of Administration for Seattle Reproductive Medicine. She's been both active on SART and ASRM committees and boards, and serves as ASRM Membership Committee President and past President for Association for Reproductive Managers. Marianne Kreiner, Chief Human Resources Officer for Shady Grove Fertility, where she works to optimize workforce outcomes through leveraging analytics and data insights to improve engagement. Marianne holds a Bachelor of Science in Business Management from Mount St. Mary's University and a Master's in Organization Development and Strategic Human Resources from the Johns Hopkins University. Most recently, she serves on the ARM Executive Board as Vice Chair. I will turn this webinar over to our presenters.
Thank you. Good morning, everyone. Please note, disclaimer that the views expressed here do not necessarily reflect the views of ASRM, and both Marianne and myself have nothing to disclose. So as we start to turn the corner and sites are starting to open or have plans to open, it is never too early to start planning on returning your employees to work. The workplace and the usual employment issues that practices have had to deal with are not going to be the same issues as when we left. The ongoing concerns of a resurgence of the virus, continuing childcare issues, the laxed remote workforce conditions that people are used to are going to impact return to work. Combined with the new state and federal regulations that are changing daily, with not a lot of clarity as the pandemic is still new in a developing situation, which leaves us a virtual minefield for trying to do the right thing for the business and our employees. There will be a tendency to want to rush to reopen and reopen quickly, but slow down, take time, and do this wisely. Slow down enough to think through those minefields out there and those opportunities. This is an ideal time to take an opportunity to update your policies, your procedures, and agreements. And of course, a lot of these considerations will be determined by your location. So today we'll be really focusing on returning employees to work, workplace modifications, updating workplace rules, and preparing for the second wave, and we'll have time for questions and answers.
As we begin to consider returning our employees to quote-unquote normal, looking at opportunities to make this a phased approach seems to make the most sense, given the state and local laws as well as the federal guidance that has been provided. A phased approach would include taking things in stages where we may now have only critical personnel on site and only when required, balancing then some staff who are working both from home and remotely, and coordinating if an employee needs something from the office to speak with their supervisor in order to access that. From there, considering which positions will be most essential to the business and the specific tasks which will be performed is important in determining what the next phase will look like while the risk of infection still exists. Employees will be able to visit the office for limited periods for specific tasks, and there will most likely be need for masks and increased sanitation guidelines in order to meet our patient and employee safety needs through OSHA and other governing bodies. Encouraging working from home remotely for those employees who have that capability will likely still be encouraged for some time after initial restrictions are lifted. We have seen in other areas of the world, for example, in Hong Kong, workers who had returned to the workplace resumed working from home following the resulting spike in COVID-19 cases. So we then would move into another phase, again, a broader opening of these facilities, opening while that risk of infection is waning. And as we return those employees to the workplace, it's going to be for longer periods of time. At that point, and perhaps even previously, there will be state and local orders that will likely require employers to reconfigure workspaces in order to allow for necessary distancing. Other solutions that we are going to be asked to think about are to revisit our work week. Do we allow our employees to work 3 or 4 days a week or stagger shifts on a daily basis, Monday through Saturday? And there are wage and hour implications for these types of changes to the work week. So as we plan these stages, it's important to take a moment in order to think about what the actions are going to be. And of course, those with special needs or have special risks must be treated on an individual basis in order to address their concerns. And we'll talk a little bit more about that in subsequent slides.
So what should we consider as employees to get back to work? How will we return them? And the most pressing thing is going to be the state and local mandates that will limit and impact your reopening. We are seeing plenty of mandates on how to reopen, whether it be with social distancing requirements, policies that you have to have in place, PPE requirements, and you need to know what is required in your jurisdiction.
Examples that we have seen in some of the areas where we're practicing would include, even prior to reopening or moving to that, masks are required at all times in some states if you are providing essential services, and people are encouraged to go to their cars to have lunch so that there is no opportunity, if you're sharing a space with someone, to transmit the virus. And there are also others, including SART, who are recommending a daily symptom screening that may be outside of SART and be a part of a state or local mandate.
So return to work may be gradual. So if you are selecting employees on who can return, make sure you have a neutral selection criteria, which includes seniority, performance, and job function, to avoid disparate impact, which essentially means unintentional discrimination of a certain group of employees, which could be based on age, disability, religion. Also, think about employees who have skill sets outside of the job that they are doing and how they can best be utilized. I have an HR recruiter, and right now we're not hiring, but there are other things that she can do for us in the meantime. She used to work in our patient services department, so I can put her into that role. So think about how you can utilize staff. And remember, and Marianne will reiterate this, that this is not a time to clean house and get rid of people because they are a pain. This is not your excuse. Marianne?
Yeah, I think that at the end of the day, it comes down to what you were saying, focus on the business needs. And then, like we're asked to do in all of our clinical aspects of our business, document. Why did you make these decisions, and deciding which employees are coming back first? Because you will need it later when you are second guessed by Jane and Mary, who work in the same positions in the same office, and one was brought back and the other wasn't. So take the time to just write that down, and you have it in case you need it. Hopefully you won't. And the other point is, when you are transitioning someone to a different role, if you are transitioning them from a position that was once salaried because of the job duties and therefore exempt from receiving overtime, if it is you are transitioning them to work, in this example, in patient services at a front desk position, you may need to reevaluate their job, even on the temporary basis, and convert them to being paid on an hourly basis because the duties that they are performing are hourly, non-exempt duties.
So considering remote work, I can be the first to tell you probably 4 months ago, I have been quoted, I'm not going to have my call center work remote. And guess what they are doing right now? They are working remote and will continue to do so for quite some time. And you'll probably receive a lot of requests to continue to do remote work. What is important is to be careful not to assume people can't return to work because they are in a vulnerable population, over 60, pregnant, or childcare issues. That can lead to discrimination lawsuits. Of course, if they're bringing it up to you, try your best to accommodate their needs. Consider all the laws that are associated with this: data privacy, wage hour, workers' comp issues.
I think that in addition to thinking about how you're going to handle these requests that are inevitable and potential ADA accommodation requirements, you need to remember to tread carefully when it comes to remote work for your hourly, non-exempt employees, because it is a higher level of responsibility for the employer to ensure that their employees are recording every hour that they are in fact working. And that includes the time that they're accessing your system to send emails. Now, I'm not talking about a de minimis period of time, less than 10 minutes, but it's important to make sure you are layering in an audit function, even if it's a manual process that you do once a month, to make sure that you are screening a select group for their adherence to your punching in, punching out requirements.
And of course, you're going to want to notify your employees regarding their return to work, and that can be done via letter. And you'll want to include return to work date, schedule, change in pay, and change in job.
You may have terminated employees that you're going to want to rehire back. It is that you did not furlough them and instead went to terminated them. And if you did, the best practice would be to put them through, as if they are an applicant, through the normal application process, even if it is that you forego formal interviews. And that means an application, depending on the length of time that they were terminated, doing the I-9 form and the normal hiring paperwork. And it also may include criminal background and credit checks. Again, some of this is going to be dictated by state-specific laws. California has state-specific laws on this, but others are going to be dictated by your in-house requirements for rehires. And it's important during this time that you follow those. And again, ensure that your employees who are returning to work, regardless of whether they were terminated or if they're coming back and increasing their hours, that if you are moving them into a different role or having them work still at reduced salaries, it's important you look at those exempt individuals and ensure that you are paying them the minimum required by the FLSA. So under the FLSA, Fair Labor Standards Act, most of our exempt employees fall under the white-collar exemptions, which are the executive, administrative, and professional exemptions. And as an exempt employee, you must be paid at least $684 a week in order to continue to be treated as an exempt employee and not be treated on an hourly basis. That doesn't mean you can't bring back that exempt employee, but if you don't need them full-time and they are going to work less, you must pay them for every hour that they're working. If that's 12 hours, you're paying them on an hourly basis, and they are eligible if they work over 40 for overtime. So consider also the impact of some of these other laws that have come out during the pandemic. One would be the CARES Act. Think about the individuals that you are thinking about bringing back to work and the impact partial work may have on their eligibility for unemployment insurance. There are certain scenarios, depending on the state that you're in, and it's a different threshold for the weekly income in every state, but they may be paid more to stay home in the short term rather than returning to work on a part-time basis and therefore becoming ineligible for that additional $600 federal benefit. It's a highly individualized analysis, but it's something that you may already be facing. It's an important consideration as you're bringing people back. As it relates to the Paycheck Protection Program, if you obtained a loan under the Paycheck Protection Program, you have to be sure to comply to the loan use requirements if you plan to obtain forgiveness for the loan as permitted under the CARES Act. For example, 75% of the forgiven amount must be used for payroll, and the loan forgiveness may be reduced if you don't maintain or quickly restore staffing and employee salary levels for those salaries that are less than $100,000 annualized and have been reduced by more than 25%. Finally, the other was the FFCRA. For those of you who have fewer than 500 employees, may in certain circumstances be required to provide paid or partially paid leave to employees who are unable to return for those specified reasons under the FFCRA. So keep those in mind as you are preparing and know what those implications are. The EEOC, as many of you know, have updated their guidance for employers. We are now permitted to do temperature checks, and they've affirmed in updated guidance that just came out that we may administer COVID-19 virology tests to determine whether employees are currently infected before they are allowed to return to work. Now, that doesn't mean you have to do it. It means that if you would like to do it, you are able to. As far as reasonable accommodations, you still must accommodate employees who need reasonable accommodations, whether it be for a disability or religious purpose. So if they need non-latex gloves, or if they are an individual who relies on lip reading and needs a modified face mask, unless you can show that an accommodation would pose you an undue hardship, you need to provide them with the non-latex gloves or the modified face mask. And I would say keep in mind there may be individuals who don't currently rely or need an accommodation, that they need to ask for that accommodation, whether it be that they are requesting telework or something else. We are not allowed to ask employees who don't have COVID-19 symptoms to disclose whether they have a medical condition that would make them especially vulnerable to complications. It is their obligation to tell us. So this is not something that we should be asking our employees if they have a medical condition that would make them vulnerable per the updated EEOC guidance. Of course, we want to remind people that they need to not come to work when they're sick, and that may require some training, such as when it comes to your social distancing guidelines. What are the expectations? Where are you going to eat lunch? Use your elbow or knuckles to open doors.
I think, working remotely, I can tell you for myself, we've had, a little bit a more laxed work environment with, virtual happy hours and switching from your nighttime pajamas to your daytime pajamas, and calls with my child running through while I'm doing Zoom calls and dogs are barking. It is a time to understand and have some flexibility when employees return to work, that this will be a transition for them as well. Update sick leave and other leave policies. So to accommodate the new normal, you will need to implement measures to ensure the health and safety of your employees, but may also need to change other policies and practices to accommodate the new normal. A thorough analysis of existing policies should be undertaken to include adjustments made from recent legislation. So some of those policies may include attendance, vacation paid time off, remote work hours. Like Mary had said, you may have people who work 2 or 3 days instead of 5 full days. Start times, breaks, lunch times, flexible hours, staggered work hours, time keeping, including clock in and out procedures, leave policies, including sick leave, travel policies, including business and personal travel, and information technology and usage. Then you're going to want to check your health insurance to ensure that it's CARES compliant. Whether a plan is self-insured or fully insured, sponsors and administrators of group health plans will need to adopt changes to ensure that their plans comply with the changes made by the FFCRA and the CARES Act, and provide sufficient benefits to combat COVID-19. Employers must update their plans to provide coverage for testing and vaccines, and consider amending their high deductible healthcare plans to provide first dollar coverage for telehealth services. Employers will need to prepare required amendments and summary of material modifications documenting these changes and communicating them to your employees. And as Mary Ann mentioned, if you're an employer who qualifies for FFCRA, so under 500 employees or a public employer, have a request form ready so that you have proper documentation to receive the tax credit. So I will be the first to admit, and maybe I'm the only one on this call, that a few years ago when I would see SART emails and emails from ASRM, I might have hit the delete button a little too quickly or pushed it aside because I thought it was a little too sciencey for me. And I can tell you that SART and ASRM have done just a phenomenal job of providing resources for all of their members, medical and non-medical. So much so that Marianne and I have included our next 3 or 4 slides of this most recent SART recommendations that was posted last week. So the first recommendation is to consider staggering clinic staff into 2 distinct teams to limit exposure. Consider staggered scheduling and group scheduling to minimize the impact of COVID-19 exposure on your workforce. So for me, I've mentioned that I have a call center team. I will have Group A that works from home 1 week, and Group B will be in the office, and then the next week we'll switch. You'll want to implement sick leave policies for staff that are non-punitive. Be flexible. Flexible really is going to be key to the success of returning to work, and you'll probably hear us say this a few more times throughout this presentation. And be consistent with public health guidelines. Move desks or have employees work remotely to adhere to physical distancing standards. And where a minimum distance cannot be maintained, 1 or more mitigation strategies need to be implemented, such as body orientation or physical barriers installed, like the sneeze guards, where practical. Face masks should be worn by staff at all times while in the clinic. In some locations, this may be the law. Marianne, did you have anything to add to this?
The only item I would say is, the embryology lab might be a place where the body orientation is going to be an important fact, that people need to move themselves and point their faces away from one another because a physical barrier or minimum distance is not otherwise able to be maintained.
So you may want to consider requiring that staff change clothes upon arriving and when they leave work. Implement and educate staff regarding cleaning and disinfection sanitization protocols consistent with the CDC and OSHA guidance within their work area. Employees should be encouraged to wipe down their workstation, including the desk, monitor, keyboard, laptop, chair, etc., multiple times during the day. Employees who use a common area for lunch will be expected to clean up after themselves, wipe the table, the seat, refrigerator handle, vending machines, microwave oven handle, and touchpad, etc. And then impose appropriate limits on business travel, and this includes between offices as well. Request that staff be open and transparent about their personal travel plans. Recommend staff avoid recreational or other leisure classes, meetings, or activities where they might come into contact with contagious people. As part of routine practice, educate staff to regularly monitor themselves for fever and symptoms of COVID-19. Staff should stay home when they're ill. If a staff member develops a fever or symptoms consistent with COVID-19 while at work, they should keep their face covered or face mask on, inform their supervisor, and promptly leave the workplace. And all staff should be screened at the beginning of their shift for fever and other signs and symptoms consistent with COVID-19.
So this would need to be documented as far as what that was, and as well asking questions about the presence or absence of symptoms consistent with COVID-19. And there should be a policy and procedure that's developed for addressing those employees who report symptoms, diagnosis, or potential exposure, with specifics for quarantining and testing of staff before returning to the workplace. And in the SART Executive Committee considerations, they did include an example that you can click on and take you directly to the CDC website. We're also, another consideration which was not included, is to think about how you can limit the number of visitors in the site. Certainly during this soft opening and a more broader opening, limiting those outside visitors is necessary. And you may want to think about asking that there are no outside food deliveries during shifts until further notice. Ask that people plan their meals accordingly and bring their lunch to work in a small cooler. Again, thinking about there may be some overcrowding in refrigerators. And then also another way to limit the number of visitors into your sites would be to cancel, postpone, or move any non-essential meetings, gatherings, workshops, or training sessions, which for us may mean injection classes and the pharma or drug reps to a virtual platform rather than having them come into the office.
Now it's time to prepare for that likely second wave. So the first thing that we need to do is develop lessons learned from the first COVID-19 shutdown. I know I could have done things differently, and now that we have more information, we can be more proactive than reactive. You'll want to review technology to enhance and improve remote work capabilities. I can tell you I need to order more laptops. We were not prepared to have as much staff working remote as we do now. So we actually rented some laptops to get us by, but we will need to purchase them because this will come up again. You'll want to cross-train employees so that they can wear more than one hat and utilize them. And then you want to expand, leverage geographically diverse work populations and suppliers so that you're not stuck with one person or one location if things do go bad and we do have another shutdown. And then, of course, you want to procure appropriate sources of PPE. So stock up on that toilet paper now.
Thank you. We will now open up the floor to take questions for our panelists. Jessica Goldstein will be moderating this session.
Our first question is, how would you address staff who refuse to return to work and want to continue working remotely?
I think that it's important to have a conversation with the employee in order to determine what the concerns are and if there are any disabilities or special considerations that need to be taken into consideration for making an accommodation, just like we would with any other reasonable accommodation. But when it simply comes down to something such as fear, it's important to walk them through and really collaborate with them to say, look, what is it that you're afraid of? And here are the things that we're doing. And some of the things that may help to reassure staff would be to communicate some of your social distancing guidelines that are being put into place, that are being recommended by SART or other organizations in order to help ensure that we're maintaining a safe workplace. Sarah, do you have anything to add?
I would just add to that by following the CDC recommendations and the state mandates that allow us to work and to operate and to still be functional, that it is okay to return to work, and they're doing this safely and according to all the guidelines that we have been given. And so I would just reiterate that as well.
Our next question is, how long do you think it'll be before vendors and reps can start coming back into the office rather than meeting by Zoom? And a corollary question from a different person is, how are you communicating that with vendors? And when you do bring them back in, will you be checking their temperatures like you will employees as well?
So for us, I think that looking at phase one, when we are still having many people working from home, it's not the time to have visitors coming in and to have additional people that you have to screen. So I think we're looking further down the line into when schools reopen. You know, when you have more of these larger social gatherings as states start to further reopen, that would be when you can start, you know, doing more things in person, or even before. You know, again, it's a very state-by-state specific evaluation because every state is recovering differently based on how they've been affected by this. And then the communicating to the vendors, Sarah, maybe you can speak to that question.
Right. I would be emailing and communicating with them, saying that during this time we are, restricting access. At this point, our clinic isn't even having partners allowed in our waiting room. So I would have a hard time bringing in a drug rep at this time. And we are doing temperature checks for everyone who enters into our facility. So we would also do temperature checks for the vendors, I would assume. We have not come across that yet because we haven't allowed it, but I would assume we would do that as well.
I have a few questions about temperature checks. I have one, are temperatures mandatory to take for all employees? And then another question would be, how would you operationalize checking temperatures? Do you have to check them yourselves? Will you rely on self-reporting?
So it will be state specific, and whether or not that's being required by your local Department of Health. So in the states where we're operating, and we are able to have it be self-reported. Some locations, some businesses, I should say, are operating this through a survey that people take before they come to work each day. So it is not something that you have to stand at a door and take people's temperatures. If you work in a facility that's a hospital, they're probably already doing that for you, and you can take advantage of that. But if you're working in a professional building, it may be easier and still meeting your requirements by having that survey be taken on a daily basis. It provides you with the tracking that you need. And the one thing to keep in mind is you still need to make sure that you appropriately protect that data that you receive. So if it is that you feel safer doing a paper form, you can definitely do a paper form.
Another question regarding temperature checks. What about FedEx, UPS mail delivery of linen and gases? If the temperature is above 100, would you refuse the tanks? Not sure the benefit. We would want to know what we should do for delivery personnel as COVID positive and protect ourselves.
I think that if you are testing your patients and doing it when partners are coming in, there may need to be a determination of, is there a place where delivery people can be met, or where they can leave those items somewhere else. But the reality of it is there are going to be delivery people that need to come into your facility, and therefore they are going to need, like any other visitor to your facility, going to need to have that temperature be checked. And if it is that they do have that temperature that's elevated, they need to contact someone else in order to make that delivery for you. And I would hope, certainly, these are critical essential infrastructure workers, FedEx, UPS, and these other oxygen delivery or your deliveries for other critical items, they are going to be asked by their employers to be upheld to the same level. So I don't think that it's a surprise to them going in other places. They're having their temperature checked if they're coming in. This is about protecting your staff and your patients.
Another question is, how are you going to change your staffing PARs to account for potentially sick employees that don't know they're sick till the day of work?
It's like anything else. You're going to know the day that they report to you, and you'll know what's happening by keeping track of your state or local website that's providing you with the data. If we are seeing an uptick, and you yourself, as you are able to keep track of your own staff and their symptoms or other screening. Remember, asymptomatic, according to the CDC, asymptomatic providers are able to still work. But certainly if they're popping up with symptoms that are consistent with healthcare providers needing to stay home, they're going to need to stay home, and other people are going to have to cover for those individuals. And that may, part of what we're trying to do and doing some of the staggering, like what Sarah is indicating, is we're trying to minimize the impact and have another group of people that you can quickly draw from, because the reality is, while we may have a lot of people at the gate that are ready to flow through into treatment, it isn't about rushing back into all of this. It can be managed and needs to be managed appropriately so that you scale back up as the instances of the disease are going down.
I have a question now about the physical space. If cubicles are closer than 6 feet, must they be moved?
We touched on this earlier, so they don't need to be moved. You can wear masks, position your body so that you are not facing them. You try to stagger shifts. If you can move them, that does work, but you don't have to. You might not be able to move them.
It seemed like the CDC was more concerned about people who are working in some of these, I think of like high tech, like a Google or these cool tech companies. You probably have more of them out in Seattle, Sarah, than I do. But where there's, the face-to-face desks that are just like on wheels, and, where there's no barrier between the cubicles. it seemed like they were okay so long as there was a wall there, like a sneeze guard, right? Or, cubicles often have walls. They seemed like they were okay with that. It's just that, if they're working, they should have masks on. And if you've got two asymptomatic people working in desks that have, again, that wall, it doesn't seem to indicate that you need to turn your office upside down in order to comply. It seems like you're good.
If an employee reports that they have an underlying health condition, can you require a doctor's note that does not disclose the nature of the illness?
So if you go through the interactive process, when someone is saying, I have a condition, you do have to, ask the doctor, and they do have to share with you, and it obviously needs to be held confidential. So it's not that employees can't disclose that. They may not want to disclose it to their supervisor, but certainly to human resources or employee health, that information does need to be documented, along with what the physician is recommending as far as an accommodation. What's the problem? What does this person need to avoid? What can we do? Again, in the example of the mask that is available for lip readers, what can we do that's not going to be burdensome on our business in order to help accommodate that?
What measures would you recommend to take around testing of employees in terms of who and how it is recorded? How are results managed and compiled? And also, would you implement additional confidentiality agreements to those managing that process?
So when it comes to testing, I think there's two different kinds of tests. There's the nasal swabs or the saliva tests to see if you have an active infection, and then there's also the tests where to see if you have the antibodies. So for our practice, what we have decided is that people need to be tested if they're symptomatic, obviously, and then if they're returning to work. We follow the CDC guidance of what they're looking for when people are returning for work. There is no ongoing testing that's being required because it's hard to say what's the cadence of that test. How frequently should they be tested? And does the antibodies, do they really provide additional protection? The data is still coming out. That decision has to be, like everything else we've been doing during this entire crisis, continue to evolve. We're not going to keep that as the same decision if data tells us differently.
Our practice is doing the same thing. We are not requiring testing either. So.
I do have a question about virology testing of employees. If you do require or request your employees to be tested before they come back to work, what is a good interval to retest, or should you retest?
So I would have to put that one on. I am not certain what the data says. I just know from the EEOC side of things, as an employer, you are permitted to do it. The interval, I'm not aware of guidance on that. Sarah, from a clinical side, are you aware?
I'm not either. I think the first place I would take a look is the CDC and Department of Health if they had what their recommendations were.
Another question is, if you have different teams and a staff member on one team is diagnosed as COVID positive, would you switch the entire team out midstream?
The answer now is different than what it was back in March. The answer back in March was, yeah, everybody is now on quarantine, and that's not what the guidance says for healthcare providers at this point from the CDC. And that is, it's a low risk. If everybody in your clinic are wearing masks and it's a low risk interaction, you don't have to quarantine everyone so long as they are asymptomatic. So no, you don't have to swap out the entire team.
Another question here is about phased approaches. Is when do you see your individual clinics and when do you anticipate that you'll start to open back up all the way?
So we have started a very, very slow phased approach. And in Washington state, we family planning is considered critical care. You can continue to practice. Of course, ASRM has guidelines that we were following. And so although we could do it, we didn't necessarily do everything. So we are just starting to see patients over 35 and above. By the end of May, we're hoping to open up to all patients, all types of cycles. We have not doing IUIs. We haven't done Marianne. We've been really following very closely with what Marianne's has been doing as well. So, but we are doing a slow phased approach and have been doing it for probably the last 2 weeks. We started opening up business.
I think what we've seen is that different states are opening differently. New York City seems to be opening and doing a lot more in all of the clinics in the city. And each of the states, as they are releasing organizations to begin performing some of these quote unquote elective procedures, that you're able to legally begin to open your ambulatory surgery centers or procedure rooms and begin to start some of these patients. So it's important to have a sense of what's happening in your state and timing things appropriately to begin patients when you plan that the stars are going to align, and be prepared to adjust it if for some reason that changes.
We've also capped our cycle starts for each week so that we don't have a huge number of patients coming in. So we are also staggering the number of patients each week.
Do you have any final thoughts for our audience?
The best places that we have found in order to research and learn more certainly have been through the same places that all of you are looking for information, looking to ASRM and SART for guidance that's coming through, supplementing that with various legal organizations who are uploading their information specific to employment-related matters, and the CDC and other organizations. And this will be a continued fight as we go through what's likely to be another round. But the steps that we take now will help to position us to answer what might be a second wave.
I think I'll just reiterate what we've been sharing throughout, is to continue to lead with empathy and flexibility. This is a scary time for employees, and just guiding and working with them throughout this process is going to be key to employee morale and getting people back to work safely and productively, and will be important.
Thank you, Sarah and Marianne, for sharing your recommendations and answering questions. And to the attendees, thank you for joining us. You will receive a survey by email after this session. Your feedback helps us give you the most relevant content. Your input is appreciated. This session was recorded and will be available on our website in the near future. Please join us for our next webinar. April quarantines don't bring May flowers, but instead an arsenal of new tools to benefit your practice. For any further questions or comments, please don't hesitate to contact us at webinars@asrm.org. This concludes the webinar. Thank you.